Great. Welcome, everyone. It is Tuesday, February 7th, and you're back with the House Healthcare Committee. Today, we're going to continue with looking at various compacts. Today, we're going to do H77, which is a compact related to physical therapy licensure, and a compact related to audiology and speech language pathology. If we have time, we may come back and have a committee discussion about the compact we did last week, which is the counseling compact. So today we have with us Tim Devlin from Legislative Council, if you want to come up, and Amron is here too. But Tim drafted these compacts, so he's going to walk through them with us first, and then we'll turn to the Office of Professional Regulation. So what we have on our webpage is the bill, but we also have a summary that Tim put together, and that's what we're going to walk through, just like we did with Katie last week, rather than the whole bill. But if you have questions specifically connected to the language, line item or something in the bill, we can talk to that. So I'm going to turn it over to you.
Thank you, Madam Chair. Good afternoon, everybody. For the record, my name is Tim Devlin, Legislative Counsel. And as was just stated, I'm going to basically just kind of walk through the outline that I prepared for H77, Act relating to adoption of the Physical Therapy License Compact. So, H77 would enter Vermont into the multi-state Physical Therapy Licensure Compact, or PT Compact, as I commonly refer to it throughout here, just in abbreviated form, as amended by the PT Compact Commission. There are currently 28 states in the compact, including New Hampshire is the closest ones to us, that's adopted this. Another 5 states have enacted legislation, but have not yet issued or started issuing or accepting compact privileges. We'll get into what those are a little bit further down. By entering the PT Compact, Vermont agrees to mutually recognize other member states' physical therapy and physical therapist assistant licenses, as well as the rules promulgated by the PT Compact Commission. By enacting this bill into law, Vermont would essentially be entering into a contract with other states that are parties to the PT Compact. Therefore, the PT Compact provisions of the bill cannot really be amended. The PT Compact provisions, however, may be supplemented with provisions for Vermont's implementation and administration of the compact, so long as those provisions are not inconsistent with the compact itself. This is what is happening in the proposed committee amendment regarding the state administration and criminal background checks that I get into at the bottom here. The PT Compact contains the following main provisions. State participation in the compact. Each participating state must, 1, use the PT Commission's data system, 2, receive and investigate complaints about licensees, 3, notify the PT Commission of any investigation or adverse actions of licensees, 4, require criminal background checks using Federal Bureau of Investigation, FBI, record check results, 5, comply with PT Commission rules, 6, recognize national examinations for licensure, and 7, require continuing education for license renewals. And just like to pause here for a moment and note that there are numerous footnotes pointing to where in the compact this language is particularly described, as well as some other kind of resources like the Commission's website, some other definitional things I found may be useful to you, but you may not want to dive into right here, the kind of surface level analysis.
Right.
Moving on to other main points, compact privilege. This is really at the heart of this compact. Physical therapists may practice that is a party to the compact. Those are the compact refers to as member states. Next main point, requirements for licensure and compact privilege. Physical therapist is licensed by their home state, that is their primary state of residence. To qualify for compact privilege, a physical therapist's primary state of residence must be a member state. Pretty intuitive. A physical therapist must meet the home state's qualifications for licensure, which at a minimum must include a criminal background check and meeting education and exam requirements. A physical therapist must have no encumbrance on any state license, regardless of whether the state is a member state or not. An encumbered license means a physical therapy license which has been limited by a licensing board in any way. Pretty broad definition. Next main point, compliance with state laws or practicing. When a physical therapist is practicing in a member state, the physical therapist is required to comply with the laws, with that state's laws. Next main point, discipline of physical therapists. A home state shall have exclusive power to discipline and impose adverse action against a license issued by the home state. This includes the ability to discipline based on factual findings of another member state. If a home state disciplines the physical therapist license, the physical therapist's ability to practice under the compact license is suspended until all encumbrances have been removed by the home state license, from the home state license, I should say. The member state's decision that participation in an alternative program may be used in lieu of adverse action. And we see this most often, I believe, in it commonly occurs in substance abuse. Next main point, compact licensure data system. Member states are required to share licensure information, including any disciplinary actions, in the compact's coordinated licensure information system. Next main point, Physical Therapy Compact Commission, or the PT Commission. This is governing. The PT Commission promulgates uniform rules to facilitate and coordinate the implementation and administration of this compact. These enforce an effective law and shall be binding in all member states. Each member state has one delegate on the PT Commission. The head of the state licensing board, in Vermont's case, the director of the Office of Professional Regulation, selects the delegate. Last main point, withdraw from the compact. Withdrawal. The state may withdraw from the compact by repealing the enabling law, this compact, but the withdrawal does not take effect until 6 months after the repeal, and during that window, states must comply with the compact terms.
Can we let's stop right there before we go to the amendment. So, and I'm going to also back up a little bit because Bobby's back. Welcome back. And I know you missed the first conversation about compacts. So and Tim, jump in here at any time, but basically in simple terms, a compact allows whatever the provider category that we're focusing on to, if they're licensed in Vermont and we join a compact, they could then work in the other states as well with a license from that state without having to go through the full process of getting the new license. And each compact is slightly different, but that's the general concept of what we're talking about here. So are there any questions? Go ahead, Leslie.
I have a question about general compacts, so I don't know if I can ask now. So I understood from our compact conversation last week, you were talking about mental health counselors, that there could be no amendments or no alteration. But now what I'm hearing is that we can make amendments. So I just want to understand those two ideas.
Sure, happy to speak to that. It's really better understood you can't make amendments, but with the exception of how the state may administer this. And so and we'll get into this with the proposed amendment here, is does the state have, for example, the requisite authorization to participate with its federal partners for really rolling it out. But when it comes to the real operational rules of compact or licensure, as it's understood, being in a reciprocity across state lines, can't really be touched. So I kind of put it simply here.
So we could put it, if I may, we could put an amendment on the mental health compact in this kind of way, if we thought it was necessary.
I haven't seen, Lauren Lehman.
Thank you.
Lauren Lehman, General Counsel for OPR for the record. Is it all right if I respond?
Yeah, please.
If I haven't seen this amendment, I assume it's about the FBI background checks. So what's being amended here is, and yes, we can add it to the counseling compact as well, It authorizes OPR to do those background checks because we don't usually do those. We have not historically done those background checks. So the amendment here, if we're not amending the text of the agreement, of the compact, we're amending our state laws so that we can comply with the compact.
Okay, so we're amending our state law, not the compact.
Yep.
Okay. If it was not like the FBI check, something else came up, it would only have to do with the state law as it applied, then we could amend it in that way. I'm just, yeah,
I think it's useful to think of the amending as supplemental to the compact would stay. And then
compact's intact.
So we're not amending the compact, we're amending something else and putting it on the compact because it's required of us to put the compact through.
So,
So let's do this. Let's finish this.
Yep.
And then when we have the Lauren and Lauren come up, we can talk more about this. Does that sound good?
if it's okay, yeah.
Yeah, okay. So let's continue. Any other questions on the compact before we go to the amendment? Okay, go ahead, Tim.
Okay. Moving on to the bottom of the outline here, the proposed committee amendment. While the PT compact does require the state to fully implement a criminal background check that uses records from the FBI in making licensure decisions, the PT Compact Commission has encouraged states to adopt additional explicit statutory language authorizing the executive branch. In Vermont, the Office of Professional Regulation to exchange identification records with the FBI for licensing and employment, which is required under specific federal law, which I cite here, Public Law 92-544. This proposed amendment does that, as well as more clearly authorize the Director of the Office of Professional Regulation, the authority to oversee the administration and enforcement of the compact and designate a delegate to the PT Commission. The two-page committee amendment was drafted following the compact's guidance, is in line with statutory language in other compact member states.
Does that help explain it? At least that
So
piece
if
of
I'm
it?
understanding it right, request is coming from the PT compact people, right? Is that what you're telling me? Is that what this is saying? That the PT compact has encouraged state to adopt this, whereas the other compacts have not asked us to do that?
The organizers of this compact has flagged it as a potential issue. If you look to this compact.
Yes.
And we should look at, I know we're clumping all the compacts together in testimony, but each one.
I understand that they're very individual, but what I thought was we couldn't amend it. I get that we can't amend the compact itself, but that we can amend our state, this is what I'm getting.
Yes.
Amend our state law to do this particular piece at the request of the PT compact, or the recommendation, let's
To
say.
make sure that we can comply with it.
Thank you.
Okay, any questions before we hear from Office of Professional Regulation and some physical therapists? Great, thank you, Tim. Are you just gonna stick around for the next one or, okay, great. Oh, do we have a second chair up there? Did we lose our chair? Oh, okay, great. Thank you, Bobby.
Musical dancing chair instead of musical chair.
I have two of them.
The amendment that Tim was just talking about on the committee page. Can be on the committee page so we can look at it.
It's on the committee page.
It's not.
That's what I'm looking, that's what I'm looking at.
It is.
Where is it?
It's in the qualification.
Documents. Under 10.
Tim as introduced, and then I have the
No,
summary.
on summary page.
It's on the summary, okay.
But is the actual language?
Yeah, that's what I
Oh,
used.
that's what.
Language.
That's, as introduced.
Okay, so we don't have proposed language on the amendment yet. Okay. All right, sorry for that.
No, I apologize for that. It was on my list to send it to you and I never did, so I apologize.
For the record, Lauren Hibbert, Deputy Secretary of State, and I have with me.
Lauren Lehman, General Counsel for the Office of Professional Regulation.
And thank you, and thanks for allowing us to continue to tag team with each other. I have filed written testimony on this compact and the subsequent compact, a tailored overview of compacts for those who were not here last week, and then an overview of the physical therapy compact. If I could just get right to the proposed amendment.
Yes.
We have really struggled at OPR, and we are now in a successful place with our authorization for criminal background checks. So we really need this language to be crafted very carefully, and professions that are being added to be added to our Title III. That's what we need, because the FBI is looking at that language.
Okay.
And they've deemed that language sufficient, not perfect, but sufficient for us to get background checks. And we're audited by the FBI. As you can imagine, criminal background checks are very highly controlled, as they should be. And so the language needs to be very precise. So I actually just emailed you, Madam Chair, and Legislative Counsel Devlin, and also Kate McClinn, the proposed language for the counseling compact.
Okay.
And that just needs to be replicated for the other compacts.
Okay.
Because there's a specific section in Title III that needs to be amended to add the new professions. And the language, our view is the language that's in the current proposed PT counseling, physical therapist compact is not sufficient by the FBI
Okay.
to give us authorization. So we need that specific language added to Title III.
Okay. So let's make sure you two talk.
Yeah.
To make sure the language ties up, but I want to be clear that the language that you're going to put forward and work with Legislative Counsel on can be applied to all of the compacts.
Right.
You want it to be applied.
I want it to be applied to all the compacts. Essentially, it's the authorization language that's already been pre-approved by the FBI. And then it specifies which professions we're allowed to ask for a criminal background check. And so we need the counseling professions to be added, and we need the physical therapists to be added, and presumably we need the speech language and.
Right. Yep. Okay. Got it. All right. So we will not focus on the amendment today
Thank you.
then, and have you two work on that.
Can I ask a question? Yes. What about the nursing compact? Does that have to be amended?
We already have done so.
Cool.
And we did that when the nursing compact was added. And in this very specific way that I'm asking, because it's so complicated.
Sounds like a plan.
Okay, thank you. I just get nervous when I hear about this topic because it's been a lot of work on behalf of our team to get this ironed out between the FBI and VCIC. And
VE.
it's been, the Vermont Information.
Crime information.
Oh, okay.
It's with public safety,
Okay.
who actually does the background check. So we receive authorization from the FBI. The background check is taken at a sheriff's office or police station. It goes to VCIC, and then we receive the results.
Okay.
We have very specific requirements about how we handle the results and what we do with the results,
Okay.
and how we apply them. So.
And remind me, the state of Vermont does not require FBI background checks with our licensing process outside of
That is correct. So we have a very limited group of professions that require a criminal background check, ever expanding. But it was before the nurse licensure compact, it was real estate appraisers, and that's because it's required by the federal government after Fannie Mae and Freddie Mac. And PI and security if you are getting an armed endorsement, which makes sense.
Yep.
If you're carrying a gun.
Yep.
And now nursing.
Okay.
And if these compacts go through, it will be the Allied Mental Health Board, which would include, our proposed amendment would include the licensed in marriage family counselors and the licensed mental health counselors, and then the roster, the non-licensed, non-certified
Okay.
folks. And then the PTs and SLPs.
So for the professions that haven't needed the FBI check, if we join a compact, those providers practicing in the state of Vermont are still fine. It's just if they decide to go for a license in a compact state that the background check will be needed, or will we have to go and give everyone a background?
So I think it's frankly a policy decision of the Director of the Office of Professional Regulation and the Secretary of State. We made the policy decision after the nurse compact was enacted to fingerprint every nurse in the state. And the reason was we were one of only 4 states in the nation that did not criminally background check our nurses. Most people were really surprised that we did not criminally background check our nurses. And the Board of Nursing really supported criminally background checking our nurses. So we made the policy decision to begin criminal background checks in that profession, regardless of whether or not you were seeking the compact or not. And it's a one-time process. You know, we're not going to do it every renewal cycle, but we are going to do it when you at the first instance or during this renewal. So we are in the midst of triaging that with our nurses. It's a big ask. And it's a big ask operationally for our team and also for VCIC with public safety. And it's going relatively well. There's a significant backlog right now, but the majority of states background check every single one of their licensees, regardless of what type of license it is. You know, if you want to be a floral designer, which is a license in some states.
Really?
Yeah, in North Carolina, if you want to be
We've done a flower shop. So that's why I'm just like,
You got a license?
I'm sure I might have chosen that. But that is a license.
Now you get background checked.
You get background checked for that.
And you get fingerprinted to be that?
Fingerprint background check. So it's
What they worried about?
I don't know. But there's, some states have a very broad concept of what is necessary to protect the public. And Vermont has had a very limited use of background checks for a variety of reasons. And we have been cautious about expanding because of the load in the state for criminal background checks. And just to be clear, as I always like to say when testifying about our policy around criminal background checks, it's not that we don't ask people if they have been convicted of a crime. We do. We have them attest to it under the pains of perjury.
Okay.
We also have people who lie to us, and obviously fingerprint supported background checks resolves that issue. But we do have some checks and balances to ensure safety.
Right.
And we prosecute people who lie to us.
Okay. And so that's wonderful to hear, but I just also want to be clear that us entering this compact is not, all of a sudden people aren't going to be able to practice because they don't have a background checked. It's a process that you'll work through.
That's correct.
Go into this compact, nothing will change for the providers.
That's correct. So, I mean, we haven't talked about this, but with physical therapists, I would assume that we will start background checking all of our physical therapists because of the nature of their work, where they are, the population that they work with. We would probably do it in phases, or we would give people a lot of time. In fact, the amendment on the counseling compact, and I'm sorry to talk about that, but the amendment for the counseling compact that I've just emailed you allows for us to begin background checking this summer for the counseling professions, but we wouldn't want to implement the compact until a year following.
Okay.
So we could get people through the process in a triaged manner. We didn't quite have that ability with the nursing compact. And with all of these compacts, for instance, if you've been convicted of a felony for the nursing compact, you're not eligible for a multi-state license.
Right.
But you are eligible for a single state license. And Vermont and the Office of Professional Regulation, I would articulate, has a very strong policy to license people who have criminal backgrounds. We really firmly believe that that's an important thing to do, that an occupation is part of rehabilitation, and that people should not be precluded, if at all possible, from an occupation because of their criminal history.
Great, thank you. Okay, we good to go back to the beginning we won't go through the overview, but it's there, and Bobby, we're happy to answer questions as well. But if you want to, I guess, maybe start on page 2.
Sure. So I'll just give the background and then turn it over to Lauren to get down into the details. So the PT Compact is an established compact. It is something that we have been watching for a long time. And its compact commission has been meeting for a while. So unlike the counseling compact, it has its administrative rules already drafted and implemented. And it's currently offering the privileges to practice. So if you compare it to the last compact we talked about, it's much more fully cooked. And 33 states, including New Hampshire, have adopted the physical therapy compact. And I did put a map there. So you can see that the dark blue is implemented. And we are in a sea of percolating or soon to be implemented in the Northeast, but New Hampshire has joined.
Thank you. So the features of the compact, very similar to the structure of the counseling compact. It's a privilege to practice. So you'd obtain, the PT would obtain a license from their home state, which is their state of residence, and then seek a privilege to practice in another state, wherever they named. They'd go to the compact commission to name that state. The compact commission would then charge a fee per state requested, and part of that fee could be collected by the state of privilege to practice. So even if the home state is not Vermont, we'd still be able to pull down some of that funding from them. The requirements for obtaining the license mirror Vermont, so we wouldn't need to do, except for that background check, so we wouldn't need to do a lot of legislative changes to allow our PTs to be eligible for this. And it's got a lot of benefits. Mobility is a key component for that. There's a lot of similarity and overlap between states and PT licensure. So this is a great profession for mobility and for a compact. I think also one of the biggest factors for folks who, even though the states might have similar licensing requirements, so it's easy to get a license in each state, to maintain that license, you have to do continuing competency every year, which can really build up. It's continuing education for PTs, so they have to do so many hours. It's expensive, it's time consuming. So making one license where they can practice in multiple areas reduces that cost and that time commitment. The benefits are, again, kind of potential benefits, not clear, are access, whoever comes to our state to practice PT might also be going out of state. So it's unclear what would happen to our numbers in the workforce. We can only guess at this point. But during COVID, I think PT practice did become telehealth based in a lot of areas. So this could facilitate that. And again, it's unclear where our fees and the cost of the compact would be, but being able to pull down part of that compact fee for the privilege would be helpful. So really OPR is generally supportive of this compact. Again, funding could be a challenge and we will need time to implement it, but generally we're very supportive.
Great. Go ahead, Art.
You mentioned just fees and cost. I assume in all these compacts that the fees assessed will pay for the program, will pay for the OPR piece of it?
Ideally, yes, we would pull down, but I don't know that it would cover the entire cost of the program and implementation. It would probably take a
So
lot.
these things, they add to the budget,
We pulled down, so we don't have a compact yet in which we're allowed to take fees when somebody joins another state. The two compacts we're in right now, I think the DO one, the osteopathic one, they pay a small fee, but it doesn't cover the cost of participating and implementing and administering the compact. And I'd assume it would be similar for these two. The nurse licensure compact, we don't have any.
So they're going to get a compact license, but through the compact. And we wouldn't benefit from that.
Well, so if it is a Vermont resident who's obtaining a compact license, we would get the full fee.
Oh, we would?
We would.
Okay.
But if that Vermont licensee wanted to go work on their Vermont issued compact license in Connecticut, assuming Connecticut is a compact state, then they would pay a fee to the compact administration separate from what they've paid us. And that compact administration would give a portion to Connecticut. But I can tell you that it's not the equivalent of what Connecticut would receive if that Vermont licensee just went to Connecticut and got the license. So any compact has a budget impact for us. And it is of concern whether or not that budget concern at OPR should outweigh the public policy benefits of joining the compact is a separate question.
I'm glad you said that.
But it does have
It does have a cost associated with it.
Yes, and there's some things that we don't know yet in terms of what that impact is, particularly when the compact is less established. So when we're looking at the counseling compact, we don't know what the fee would be. I think we could talk to the PT compact and understand what the fee would be for us to receive from the Compact Commission, and that's on the list of things that I'm going to try and do before this bill gets sent to Ways and Means. But it does have an impact for us. And then the other model of Compact is where we don't receive any fee and somebody can just begin working here. And that example is the nurse licensure compact, where we don't receive any fees for the people practicing here. That has a total impact, yes.
And as Lauren said, if we pass these compacts, they will all go to Ways and Means to continue that conversation.
Better, I just wonder.
Yes. Maureen?
Sorry, I'm late. Do other states in any compact situation recoup some of the revenue by charging higher rates for professionals who choose to get a compact license than an in-state license?
Yes.
Has it been helpful to your understanding?
Yes and no. When we implemented the nurse licensure compact, we talked about that, Representative Cordes, and we felt like it would de-incentivize getting a compact license, and that it also would add a lot of complication to the licensure process. And so we chose not to do that. We could ask the legislature to change that. But when we ran the numbers, and again, we didn't know how many compact licenses we were going to issue, so it was sort of hard to know what we should raise the fee to. When we started to do that analysis, we quickly found that it probably wouldn't cover our revenue losses from joining the compact. That it would have to be a significantly higher fee, like $100 more, is what my memory of the analysis. And that felt like then we were de-incentivizing people getting a compact license.
Thank you.
Has there been a feasibility study to see how many are interested in signing this compact?
The PT compact? No. We did that for the nursing compact, but we have not done that for the PT compact.
Any other questions for OPR? All right, let's hear from some physical therapists. So, Michelle, you're first on my list. Michelle Downing, are you there?
Hi, I'm here.
How are you?
I'm doing well. How are you?
Good, welcome. If you can introduce yourself for the record and then start with your testimony, that would be great.
Sure. So my name's Michelle Downing. I'm a physical therapist and a small business owner in Burlington. Do you need to know anything else about me, or is that enough?
That is enough, unless you want to share more.
Okay. So I work as a physical therapist. I specialize in a few things: outpatient PT, pelvic health PT, and also persistent pain conditions. I'm the APTA treasurer, and I've been a small business owner running my own practice for about a year now. And as a PT and an APTA member, I'm here today to testify because I really believe that this PT compact will allow the physical therapy community to better serve the people of Vermont. So I'm very much in favor of it. I'll just kind of outline some of the reasons why, and then if anybody has questions, we can do that after. So there's, as many of you know, in healthcare in general, and PT is no exception, there's a very high demand and low availability of PT care in the state. And this is true both at the hospital and, small private practices like the one that I have. And, if there is an open position within these practices, we have a hard time filling the open positions. And so the net result is that Vermonters are, when they're injured, they're having a hard time finding care in a timely manner. And because there's not enough providers available. And just as personal example, I was working in a larger practice last year, Evolution Physical Therapy. And when we closed, I had 5 unsolicited job offers. And that's not because I'm so awesome. It's because there's just not enough physical therapists in the state to meet the demand. So a lot of the clinics have these kind of constant job postings available. And I really believe that becoming a part of the compact will make it easier for local clinics and the hospitals to recruit out of state because, it makes it easier for PTs to travel across state lines. And so just another personal example with Evolution, before we closed, we were trying to hire a PT to basically fill the spot of the owner of Evolution that became very sick. And we were looking either to fill it temporarily or to fill it permanently. And I think if we had been part of the PT compact, it would have been easier to recruit someone to come from another state because part of that process has been streamlined. Right now, the process to get another license in another state is kind of cumbersome, and it just streamlines the process, helps people move across state lines. And I think that Vermont would really have a net gain there. And then another way to look at that, because I heard there's some discussion this morning about is it going to be a net gain or a net loss for the workforce? When we look at the compact map, with so many states becoming a part of it, that, if I were a young PT or if I were just recently graduating and I were trying to decide where I wanted to live, I might really consider the flexibility that I would have with my ability to practice in multiple states when I decided where I was going to settle. And if Vermont is one of the few that's not involved, then, it might make people decide not to move here. So, the bottom line is that the more PTs we have, the more Vermonters we can serve. And I really do believe that the net gain, that there would be a net gain in the workforce with physical therapists in Vermont joining this compact, and that therefore we'd be able to, serve the state of Vermont better. I wanted to make sure that everyone saw the most recent map. So I texted or I messaged Claire the most recent map where you can see the number of states that are available, because I looked at it last night and I had looked at it like last week, and I think they just updated it. So right now, 44 states are, in process. They've got something going on. Only 6 have nothing going on. 29 states are already part of it. 5 have enacted legislation, and then 10 have introduced legislation. And I believe a lot of those states are going to become part of the compact this year. And so, we're, if Vermont doesn't get on board, we're going to be one of a very few number of states that is not. And, I don't think we want to be left out of that mix, as I said, because, new people, when they're graduating and looking at this situation, they really might choose to move out of state if we're not part of the compact, if they're here, or not choose to move to Vermont if we are not part of it. And I think that Vermont is, with some of the other like telehealth, like that temporary telehealth license, and in many other ways, Vermont is kind of ahead of the curve. And this is, I think, one situation we're a little bit behind the curve, and so I just, for all those reasons, I really support the compact. And just one more quick statement about the fees. So there's 2 fees. The way I understand it, there's the compact fee. Like if I wanted to become part of the compact as a Vermonter, and a PT that's licensed only in the state of Vermont, I would pay the Compact Commission a $45 fee, and then I would pay another state fee on top of that. And right now the state fees, the state determines their own fee, and that fee ranges from $20 to $150. And so there's a pretty wide range in there. And so my understanding is that Vermont could choose the fee that we felt comfortable with, or that you felt comfortable with, and that could maybe, help offset or eliminate the concern about the cost on the OPR budget, or whoever, whatever that, whoever's going to be bearing the burden of the potential increase in cost due to joining this.
Great. Thank you very much, Michelle. Are you okay with questions?
Yeah.
Great.
To answer them.
Great. Art?
Yes, thank you, Michelle. Can I assume that the physical therapy will be done via telehealth? Is that generally how this is done out of state? I'm trying to visualize, something as hands-on as therapy.
Yeah.
Being done not in person. And I'm wondering if you can help me understand how that gets done.
Yeah, I'm happy to help you. I thought about this quite a bit, and I think there's a few different ways that this could be useful. Like a profession like counseling is very clearly, easily translated to telehealth. And I don't know that this would always be a telehealth situation. Like, for example, if I was, like what I was talking about, the clinic that closed, Evolution, and we needed somebody to work like right away on a temporary basis, and recruiting within the state, we were having a really hard time, and being a part of the Compact Commission could help us recruit out of state. And so somebody would be able to move in state from out of state, either temporarily or permanently, a little bit more easily. And so I think those kinds of situations where somebody wants to move or is interested in a job in another state, to coming into Vermont, that's one of the ways that I imagine the PT Compact to be useful. Or also, if somebody's practicing near a state border, it'd be easier for them to have multiple state licenses and practice across state lines that way. So it's not just about telehealth. And I would imagine, like when the pandemic first started, I did do a lot of telehealth PT, and I was pretty amazed actually by what could be done with physical therapy through telehealth. And a lot actually got accomplished, and people did pretty well with it. But I'm not sure that, being that there's the option now to be seen in a clinic with a PT right in front of you, that a lot of people would be choosing the telehealth option. But there are certain specialties, like, for example, I have a specialty in persistent pain conditions. A lot of that is like psychoeducation, and it's not necessarily like, hands-on work. And so I could imagine where if I wanted to use my specialty in multiple states and, recruit people from other states that were interested in learning more about like how to manage persistent pain through like a biopsychosocial model, like a kind of mind-body model with a lot of psychoeducation, like that could be another situation where this could be useful.
Okay. But say, and I hate to give you a for instance, but I will. Say Vermont's in the compact, and I go to Florida for 2 months, my wife and I, and say my wife needs physical therapy in Florida, which is not one of the compact states. She can see a physical therapist there, correct? And get whatever physical therapy they have.
Yes.
Yeah.
But if, let's say you and your wife were going to go to, I'm not looking at the map. Let's say Florida is in the compact, right? Let's say you go to Florida, and this is a question for Michelle too. So say they are in the compact, your wife or you is having physical therapy now and with a Vermont provider. You want to keep that therapy going and you feel it can be done effectively over telehealth, if you go to Florida, you can now use telehealth and have Michelle still as a provider. Is that correct, Michelle?
Yep, that's my understanding. Yes. You know, and provided if there's insurance transactions happening that the insurance company is willing to pay, or the person's willing to pay out of pocket for such a thing, if the insurance company isn't willing to pay for telehealth. But yeah, legally, that would be something that would be doable in this situation. Or, you know, if somebody, you know, like I'm treating somebody and then they go to college in a state that has a, you know, and there's the PT compact is there, and I could continue to follow that person through college. The relationships that PTs develop with our clients, they're very intimate, and you know, if you know someone for over a long period of time, you really get to know their bodies in a very certain way that you know, it's sometimes hard to transition that care to another provider, and so this could help with keeping those relationships going.
Great, thank you, Michelle. Any other questions for Michelle? Great, thank you so much, Michelle. You're welcome to stay or go, whatever works for you. I appreciate your time.
Okay, thank you very much.
Thanks. Heidi, are you with us?
I am.
Hi, how are you?
My apologies. Good, how are you?
No worries. Hopefully it's not too cold in your car.
No, this is often my typical office.
Okay. I'm not sure that's good, but we're going to go with it. So if you can introduce yourself for the record and then just go with your testimony, that would be great.
Great. My name is Heidi Wilhelm. I'm a doctor of physical therapy in Middlebury. I wanted to thank you, Chairperson Hoden, and members of the House Committee on the Healthcare. For the past 7 years, I have operated my own physical therapy practice, and it serves early intervention and children birth to age 5 with Vermont Medicaid insurance. I treat them in and around Addison County. I also have kids that come to me from out of county because we do not have enough pediatric physical therapists in the state. I provide services in the child's natural environment, including their homes, daycares, and out in the community. I also do education for the Head Start program and other daycares. Today, I'm here as the president of the American Physical Therapy Association of Vermont. We represent close to 400 physical therapists, physical therapy assistants, and students throughout the state. I wanted to thank you for the opportunity to testify in support of H77 as it relates to the adoption of the PT Compact today. The overall mission of the American Physical Therapy Association is to build a community that advances the profession of physical therapy and to improve the health of society. And I feel like the Physical Therapy Compact it helps that. It definitely embodies the spirit of the mission. It enables the PTs the flexibility to work across state lines and to increase our access of service without the burden of applying for a whole nother licensure in the state. It does allow member states to charge a fee for the participation, but it streamlines the process quite a bit for the applicants. Currently, you know, I think Michelle spoke to this, the PT Compact privileges are being issued in 28 states. I think it would be great if we were part of it. I urge you to adopt the H77 so that Vermont can join this list. And I thank you in advance for consideration of this bill.
Thank you, Heidi. So I'm going to start with a question. Would this compact, or how would this compact help your work that you do within the schools and with our youth?
So if, say, New York signed on to the compact as well and we're on the compact, I would be able to see kids in New York. And if there was a physical therapist that was over on the Massachusetts border and our kids don't have a physical therapist that are in the low part of the state, they would be able to be seen by a physical therapist in Massachusetts if they were part of the compact.
Great, thank you, that's helpful. Mari and then Art.
Thank you, Heidi. I'm from Addison County, by the way. I represent Lincoln, Moncton, Bristol, and Starksboro. Thank you for your work. Just a quick question. I don't remember, is the requirement for physical therapists to have a PhD national or state?
It is now national that it has to be a DPT, which is a clinical doctorate. So it's not a PhD, it's a clinical doctorate, the DPT.
Thank you.
Art?
Yes, Heidi, you mentioned being able to see patients in other states. And I want to make sure I understand. You would be able to go to New York or Massachusetts and see New York or Massachusetts patients. But as it is today, somebody from New York could drive over to Middlebury and see you without a problem.
They could, as long as they're insurance. I only take
Right.
Vermont Medicaid right now for insurance, but yes, they could come to me.
They could come to you, but you can't go there and offer it there because of the licensure thing today.
Correct.
Oh, okay.
Yep.
Thank you. Yep.
Heidi, is the type of work you do, your physical therapy work, is it not unique, but is it more of a niche that we don't have enough providers, you said, that's doing this particular work?
Absolutely. You know, I knew I wanted to treat pediatrics, so when I was in school, I made sure my clinicals were all in pediatrics and neurology, because pediatrics is a lot of neurology and neuroscience. In our state, we've said that the quality of care for pediatrics should be in their natural environment. So my background of working for a home health agency helps that, because I have to go to the patient's homes. You know, I have to travel around the county to go to their natural environment. I go to their house, I go to their daycares, I go to their grandparents. And it's tricky because I get paid the same as a regular outpatient physical therapist. When I was working in outpatient physical therapy with adults, I could see 10 to 12 people a day. Now with pediatrics, I can only see 4, maybe 5 a day, depending on where they live. The paperwork is much more, especially with the early intervention. We were talking about very high risk parents. And there's extra authorizations. I work with a lot of the early intervention program, and I know they try to be very helpful, but unfortunately the way the authorizations and paperwork is, it's not that helpful. So I do not make that much money. I work a lot harder than I did when I worked with adults, and I make a lot less money. So I'm here to help support PT and especially pediatrics as much as we can.
Great. Thank you for that, Heidi, and thanks for the work. I know we've spoken before, and I was really amazed at the work that you do specifically with our youth. So thank you for that. Anyone have any other questions for Heidi? Great. Thank you. And again, you can stay or go, whatever works for you, but we appreciate your time.
Thank you.
And now, yes.
I got a question. I didn't want to put her on the spot, but she said she takes Medicaid insurance only. So if a child comes from another state.
She would not, I think she indicated that she would not be able to see those children because they do not have Vermont Medicaid. Yes, exactly. Now, if they paid out of pocket, and Heidi, I see you stayed on, so thank you. If they paid out of pocket or had other insurance, you would be able to see them, or you only take Medicaid?
So the APTA kind of has a saying, or it's a standard of, if a patient has insurance and you don't take their insurance, I'm supposed to tell them to go see somebody else that has their insurance. So for the most part, I do not accept referrals from private insurances. I will do an occasional one-time consultation out of pocket, but it's definitely tricky when I have parents calling me and there's no providers, and I can't take any more patients on anyway right now.
Yeah. Okay. Thank you. Okay. Next we have Julie, who I'm not sure. Julie, are you here? Because I know you weren't going to be here till 2, but you are here, which is great. Thank you. If you can introduce yourself for the record and then go ahead and tell us your story.
Sure. So I'm Julie Adams, and I am a doctor of physical therapy as well. I have 32 years of practice in adult neurology in hospital and hospital-based outpatient. So that's really where my practice has been. I'm also the recently retired legislative and professional practice chair for the Vermont chapter, and I was in that role for 20 years. So I just have stepped down and I'm welcoming Heidi and Michelle's input and and carrying the torch because I'm ready to pass it a little bit more. But I've been working on this issue for a long time, and I know both Laurens from the OPR quite well. I was involved in the telehealth committee discussions. Hi, guys. And I also I work for the University of Vermont Medical Center, and I have been there for the 20 years I've been back in Vermont. I'm a Vermont native. I started my practice out of state and had the experience of moving back to Vermont and needing to get licensed in Vermont and having that take a little while. And that hasn't changed a whole lot in the past 20 years. And I'm an administrator at the medical center. So I am involved in the hiring and credentialing process for many of our folks that we hire from out of state. And before we can credential anyone to be billable under insurance, we have to get them licensed. The insurers won't even look at their file until they have a license. So all of this takes a while before we can get somebody into place and into a position where they can actually see patients that we can bill for their time. So I just wanted to share that piece of the story. I don't think there's anything I really have to add to what Michelle and Heidi have shared with you. And you clearly have all the information from the OPR and from the Federation of State Boards of PT, who are the ones that administer the compact. I guess the one question I have for the Laurens, though, is when we talk about fees and what the impact might be on OPR is how much does it cost really to administer a license for one clinician? Because I think that will guide you in what the state fee should be for Vermont as you move it towards Ways and Means. So thank you very much.
Great, thank you. And so Julie, I just want to be clear, you do support Vermont entering into this compact? Okay, you're on mute.
I hit my space bar by accident. So I've been asking for this since 2015. It's just not been the right time before. So I'm really grateful that we're at this point. So
Great.
I absolutely support H77. Thank you for your time and your attention to it.
Great, thank you. Any questions for Julie? No? Great, thank you, everyone.
Thank you.
Appreciate your time. So unless there's questions or Laura and Lauren have a comment or Tim has a comment, I think we can transition to the speech and audiology and speech language pathology. Or we can take a little break if you all promise to be back in 10 minutes. Promise. All right, we'll take a break.